Well, joining me now is Oonagh Cousins, who's a long COVID sufferer and also a campaigner. Oonagh, very good to talk to you today. First of all, how are you? How are you feeling?
Thank you very much for having me on. Yeah, unfortunately, I still have long COVID, so I've been ill for 6 years. I'm better than I was, but I still manage symptoms on a daily basis.
What are you hoping to hear this afternoon? You've obviously been paying close attention to the COVID inquiry.
Yeah, so what we really want to see from the inquiry is an acknowledgement of like what went wrong, and we want the inquiry to recognise that early warnings were not taken seriously enough. The risk of long-term illness was not factored into pandemic planning, even though it absolutely could have been. The risk was foreseeable, but it wasn't factored in early enough. And the fact that the public were not properly informed about the risks of long COVID, they still aren't informed. And also, there was, a delayed and slow response to long COVID, but the fact that it's been insufficient to meet the scale of the need. And ultimately, we want to see, like, if the acknowledgement that if the government had made better decisions, we would not see the scale of suffering we have seen and continue to see. And from that recognition, what's really important is that people with long COVID really need meaningful support now, long term, and so we need some immediate action, and then also. Long-term illness must be built into future pandemic preparedness so this level of preventable harm never happens again.
How is long-term COVID having an effect on your life? What impact has it had?
Yes, it's had quite a large impact. Before the pandemic, I was a professional athlete on the British rowing team. I'd just been selected for the Olympics, and I caught COVID right at the beginning of the pandemic. My initial infection was pretty mild, but it developed into debilitating long COVID. One of my main symptoms is what's called post-exertional malaise, which is a really bad and misleading name that for a symptom that's extremely debilitating. Like, it's not just tiredness after exercise. Essentially, my body became incredibly sensitive to any exertion. And that, when I say exertion, I mean like preparing food, having a conversation with somebody, getting dressed, washing my hair. I had a few hours in the day of an energy window, and beyond that, I would trigger a crash that would, like, my whole body basically would go into shutdown. My nervous system was affected, my immune system was affected, my digestive system was affected, temperature regulation, cognitive function. This is a really systemic, whole body illness that completely debilitates people. Unfortunately, I have made some recovery. I'm one of the lucky ones. There are people who haven't got better, and I can work full time now, but I'm still managing symptoms on a daily basis. I can't exercise. I had to retire from rowing and my international sporting career.
It's been incredibly tough. What do you feel about the decisions government made at the time in terms of how it has affected you?
Yeah, so like, as I said, I think, long-term illness after viral infection was entirely predictable. It should have been factored into pandemic planning. But instead, the response on both the healthcare and research fronts was far too slow and limited for the scale of people's needs. Some long COVID clinics did open in late 2020, but proper guidance, national strategy took many months. Even the ones that do exist, they don't meet the need. Many of them don't meet the needs of people with long COVID, particularly those who are more unwell. And one of the difficulties with providing good healthcare is the lack of research. But then the government should have invested more in research. It didn't start doing that until 2021, and even now it hasn't met the need, and people still don't have answers or the treatments that we really need to get our lives back. 2 million people in the UK now live with long COVID, and around 400,000 are severely affected. The numbers are nuts. 400,000 people severely affected, unable to work, care for their families, participate in their communities, and the national response still falls short. This is and continues to be an area where government leadership is desperately needed. We need a national strategy to help people get their lives back.
And in terms of what was going on in Number 10 while these decisions were being made, do you feel that you've learned quite a lot during the COVID inquiry about that?
Well, it was very illuminating that essentially it wasn't being taken seriously, which we knew. We got the sense at the time. Clinicians, patients, doctors, researchers were raising the alarm, and it felt like talking to a brick wall. And that's certainly what's come out of the inquiry, and we really hope that the report puts that into writing today.
Do you think there will be any accountability from those who made the decisions? Will people, do you think, ultimately be held to account?
Probably not to the extent that we would like to see, but we really these lessons properly and making sure that this level of harm doesn't happen again.
And do you have any confidence that if we were to get another pandemic now, which experts say is entirely possible, anything would be done differently about things like long-term COVID?
I, at the moment, don't think that the scale is recognised and the seriousness. There's still an element of, there's still a lot of not recognising how sick people are and how many people are sick. And I think there's some progress has been made. Long COVID has given a bit more credibility to the long-term impacts of infections. But that's why the report from the inquiry is so important today. Like, it has to really highlight just how much damage has been done, just how much suffering there is, and just how much could have been done differently if we're really to learn the lessons that we need to learn.
Oonagh Cousins, good to talk to you. Thanks so much for joining us on Sky.